Welcome everyone to Real People, Real Healing. And this is where we have people come on and they may have, well, they think they have a disease, but there are no diseases. There are just signals from your body talking to you because you don't know how to look after yourself. And you know why you don't know how to look after yourself? It's not because you're smart or stupid. It's because they have put dysfunctional strategies and beliefs in your life. I mean, try to find a parent that feeds their children properly, loves their children properly, and that would be like looking for a unicorn. Because first of all, parents don't know how to love themselves, less love each other. Parents don't know how to feed themselves or feed an actual child, okay? And it's not their fault. You can go to school for 12, 13 years and you're coming out of school, you don't know how to do anything except make a child, but you don't know how to keep the child healthy, okay, on all levels, especially emotionally, because I've hardly even found parents that are emotionally stable, because they're not. We were on here just a minute ago, and I'm not picking on Amanda, but her daughter was hiding behind the chair, and she goes, well, my daughter's shy. And I said, there's no shy children. There's only children that lack confidence because their parents lack confidence, and that's it. Like mother, like daughter, okay? So that's it right there. So you have to understand that your children will always mimic you. And by the time that they're 2 or 3, they walk, they talk, they act like mommy and daddy, and then they get punished for it. Think about that one. Because our children come here as spirit beings. They enter into the womb. They come out as a physical being, okay? They are spirit beings having a physical adventure. By the time they walk and talk, they are mirroring everything about mommy and daddy, but because we're not taught that, we are taught to what? Like I had somebody come on here just yesterday and say, guess what? All we need to do is discipline our children. Are you like out of your skull? All you need to do is have unconditional love for them and talk to them like they are. Not adults, but they are intelligent spiritual beings that just came from somewhere. And you don't go goo goo gaga. You know, when they start to talk, you talk to them as if they have a brain, okay, and that they are a genius, because they are a genius. And you know what? You ever notice that kids will actually say things and get punished for it, and all they did was tell the truth? So let's teach them how to lie. But then they watch mommy and daddy lying to each other. And then by the time that they're 12 or 13, they're going to find out that mommy and daddy have only conditional love for themselves and each other. And then guess what? So now the 12, 13-year-old, and ask Amanda, by the time she was 12, 13, she was already looking for a new family. She was looking for someone that would unconditionally love her. And that's what's going to happen to her daughter unless Amanda teaches her daughter unconditional love. And Amanda can't do that because Amanda can't love herself, because she's been taught that's a selfish act. She can make herself pretty. She's absolutely pretty. But how pretty is she inside? Okay, now you're going to be wondering, why is he talking like this? Well, because Amanda would not have any signals or symptoms in her or coming to her if she had unconditional love for herself. Because nobody gets sick with that. Oh, you will age. You're not going to stay here forever, because that's the evil plot that we break down. But the reality is guess what? You will never have any problems physically in your body. And they're all from emotion. But so guess what? We can't address something, we suppress something. So now we got issues in the tissues. And understand something. Depending on the emotion will depend on whether it's at the front door or the back door or somewhere in between, or it's in your joints, or it's in a specific organ. Because every organ holds different emotions, and different emotions heal different organs. I bet you didn't know that. But if you guys look in your Perfect Day guide, I gave you the whole list. All right? And if you don't believe me, like I told you, go to the library and dive into the library, and you're going to see it's all about that. Hi, Amanda. Are you here?
Yes, I'm here.
How old are you?
32.
32 years old. Good.
Yeah.
What's your height?
5'4".
5'4"? What's your weight?
132 right now.
Okay, so what do you think of that?
I'm pregnant, so I can't fight it. As
Okay.
long as I'm healthy and I'm gaining weight.
No, that's
all
great.
that matters.
No, that's great. I didn't know you were pregnant.
Yes.
Okay.
I'm starting.
Okay. And how pregnant are you?
I think 5 weeks. We just found out.
Okay. All right. So what are we looking at, Kimberly? And everybody, this is Kimberly. And Kimberly, she is one of our master trainers, and she's in Bonita, Florida. Okay. And she's a go-getter. Okay. And Bonita also runs Crunch Fitness, and we'll be doing a course in Bonita, Florida after we do Australia. And we will be in Bonita, Florida in September. Is it September or October? October? Okay, they just tell me where to go and then I just go. And a lot of people tell me where to go, I'll tell you. Yeah. Okay. Okay.
So, Anna, she first came to me, she was a referral, and she had broken her jaw when she was 5 years old. And so she was having all kinds of issues, and I can let her tell you that. But, I mean, she's miraculously had a major turnaround in doing Wilson non-surgical on her jaw. And we've worked on her neck and her upper back, her lower back. And what we really wanted to accomplish today is, now that she's pregnant, have you had 2 C-sections?
1 C-section and 1 natural.
Okay, all right.
And
So,
how pregnant are you?
5 weeks.
Okay, so just know this, okay? So it doesn't matter how many natural ones you have, there's never damage. And any damage is turned around really quickly. You can get some scar tissue, okay? But the calcification that you're going to get in your body and the scar tissue you're going to get when you have a C-section. So that's a real problem. That's a super problem. Super problem.
Yeah.
And listen, everybody here, you could just advertise C-sections, women, men too, but you could advertise just C-sections and you'd be booked up for the rest of your life. How many people know that 60% of women get C-sections? 60% of women. And you get 1 C-section, your digestion, your assimilation, your elimination is screwed for life. When you get a C-section, you've cut through the epidermis and the dermis, and you've cut through that far, okay? When you do that, you put all of that area, and when I say that area, when you cut with the knife, depending on how the surgeon goes in with the knife, his intention is very, if he has a loving intention, which they don't, chop, chop, and for most of them, it is. But if he had a loving intention, he's going to cause less damage. Everything is about frequency. Everything is about emotion, energy, and motion. Now, when you go in there, okay, after you do that and after it's healed, now, Amanda, you may not believe this, but you've got 2-inch to 3-inch feeders, they're called. And they're actually adhesions, and they're wrapping around your small and large intestine, and they'll be wrapping around your pubic bone, and they'll be choking off your ovaries or your uterus. So understand, sometimes you might move and you feel like, oh God, what's that pull down here? That pull is, and guess what? These adhesions, they don't stop growing the whole time. Now, if you have 1 cesarean, you're looking at 3 to 5 non-surgical treatments on the scar, okay? And understand, those adhesions will come from the abdomen, the core, and they will go all the way down and wrap themselves around your spine. Oh yeah, it's a pretty mess. Now, but you will actually go in, and when we do the non-surgical, we'll go deep enough that I'm working through the belly button area, or even a little bit below the belly button, and I'm working actually, you taking that adhesion and bringing it up against their spine, their vertebrae, and I'm pulling that apart. It's really deep work. But after you do just 1 session, doesn't matter who, every time, oh my God, I feel free. The first time I feel free. Now the bowel movements are easier, the urination is easier, less bladder infections. You could become infertile because of that. You're going to get endometriosis. I guarantee you, from the Cesarian, you've got endometriosis. There's no way that you don't have endometriosis when you get 1 Cesarian. You get 2 of them, you just compiled it. So now to do it, before I said 3 to 5, now you're looking at 5 to probably about 8 non-surgicals, and guess what? You won't even see the scar. Especially if you go to somebody with a cell-sonic, you wouldn't even see the scar, Amanda. It would be totally gone.
Nice.
Nobody, okay, understand, surgery causes more scar tissue than anything else on the planet. Now, what causes more scar tissue than any other surgery? Cesarians and pelvic clearances, meaning goodbye uterus, goodbye ovaries. Now you've got a block of scar tissue down in your groin, and now you're going to be numbed out for the rest of your life and have all kinds of trouble. And understand something, once you have a cesarean, you're going to have low back problems. And if you haven't experienced low back problems, then you're numbed out already. You cannot have a cesarean without having L3, L4, and L5. Do you know how many women end up getting L3 and L4 and L5 surgery done, fused, okay? Do you know how many women have osteoporosis, okay, in L1, L2, L3, L4, L5, okay? And do you know how many women always constantly feel like they have kidney problems, and it's all from that cesarean, okay? All from that scar tissue. Now, I just wanted to say that because, Amanda, I want you to understand that this is totally reversible, okay? And I think as time goes on, you're 32, wait until you're 45. You're going to feel like somebody went in and just tied your intestines in knots. If I've got a beautiful flowing river, if I were to build a dam at the river, how much circulation's there?
0.
Well, very little. So wherever the cesarean is, it's blocking off circulation to the body. So understand something. You'll have everything from, you're not going to believe this, you're going to go, no way. It could cause a brain tumor to a bunion. What, you think that if you're going to cut right across the core, your abdomen stores 85% of your energy, it creates 85% of your energy, and once you've done one cesarean, you've brought it down to 40. 40! That's less than half the energy. Right now, she's 32, but guess what? Watch how vitality leaves. Oh, I can remember when I was an athlete. I can remember when I would just bounce back so quick. I could keep up with the kids. I guarantee you, with every cesarean she has, and guess what? They're going to ask her when she gets pregnant again. Okay, right now, guess what? If she doesn't want another cesarean, okay, guess what? She needs to go in and have her low back, her SI joints, her hips, her abdomen, and her pelvis opened up. And guess what? That baby will slip slide right out. Do you know why that 60% of the female population is getting cesareans? Because they are so infected because they're pooping in their pelvis. That's what they're doing. You need to understand that. They're pooping in their pelvis. Nobody eats right. Who eats right? Everybody eats the same. Everybody thinks they eat good, but who eats right? I'm going to tell you something. Today, in today's world, if you're not eating 80 to 90% a whole plant-based diet, you're way behind the ball. And understand, when you are overweight, when you have symptoms, even when you have an autoimmune disease, you know what? Why don't you go back 75 years ago and find out there wasn't any? Why don't you go back 125 years ago was the first time there was a tumor? And they called doctors from 250 miles. And they even came, how? A horse and buggy. Because they were told to come and take a look at this tumor they'd never see again. And do you think we have enough tumors? Now our pets are full of tumors. Everything is full of tumors because the tobacco industry owns the food corporations. And I don't want to go any deeper with that. So now let's talk about this. So what's your situation, Amanda?
What exactly? Like
I don't know.
Jaw issue?
Yeah,
Or
sure.
lower back?
Why don't we talk about it all? Because, and guess what, Amanda, there's absolutely nothing wrong with you. Guess what? You're just talking to natural health practitioners that don't know what they're doing. Because I will tell you this much, and I get booed on this one, but 95% of all natural health practitioners are superficial and diluted. Okay? They don't If you don't know how to get rid of scar tissue, if you don't know how to get the calcium back into the bones, and if you don't know how to teach your client, your patient, how to stay in the present moment, okay, and understand that there is no such thing as shy, okay? There's only such thing as fear. There's only such thing as fear. There's only such thing as fear, okay? And if we could teach them that 99.9% of all the fear that Amanda has for her children, for her life, it never even comes true. She just goes around worrying about it, okay? And this is going to cause her to have another cesarean because it's going to put her into fight or flight. She's going to be dumping adrenaline. That's going to cause crystallization, scar tissue formation, and calcification in her body, and she's going to stay contracted. And then guess what? Oh, better cut that out. So, you better watch out on your complaints, because as soon as she complains about her low back, as soon as she complains about her hips, okay, and that she's having trouble and pains in her abdomen, they're going to go, we need a cesarean. And understand something. They'd rather do a cesarean than have the patience to wait for her. Because I'm not going to wait for Amanda. She's going to come when I want her to. She's going to deliver when I want her to. That's the chop chop world. And I can say that because that's the truth.
Yes.
Okay? And understand, Amanda, if you have a cesarean like this time, no, don't go, because unless you're going to follow the rules that I'm telling you today, and I might seem cocky, I might seem arrogant, but I'm not. I've been doing this for 40 years. You better have a natural sponge 2 inches by 2 inches handy. And you better put that into your vagina canal, okay? Let's say about at least 8 to 12 hours prior to thinking you're going to have delivery. Why? Because when they go, what they should do is they should have just put a zipper in Amanda's scar from the cesarean so they could just zip her open and make it easier. What do you think? So the reality is, if she doesn't put that 2 inch by 2 inch natural sponge into the vaginal canal nice and high, because as soon as that baby's born, she has to tell them, this is my baby and I'm allowed to do it. She has to take that sponge, just as the baby comes out, so does the sponge. And that sponge goes all over the baby's face, into its eyes, rub it into its mouth, all over its skin, and guess what? That baby just came through the vaginal canal. And understand, does anybody know why they do cesareans? Listen, you think they do cesareans because they're trying to help people? Yeah, doctors think they're helping, but they're brainwashed too. Every time you do a cesarean, the baby never got the inoculation of mummy's bacteria, which is the strongest immunity on planet Earth. They just stole it from that child. Now the child's going to be weaker, and the child will then get sick. The baby will get sick, and now it needs antibiotics, and now it's going to have allergies. How many people know right now, are you ready for this? 60% of all children in Canada and United States have a chronic disease. 60% of all children in Canada and United States. And don't tell me they're not harvesting the children. Don't tell me they're not harvesting humans. They could care. So understand, so Amanda is going to have to really take massive personal action. And she's really going to have to change things. Amanda, is your husband on your side? Or does he like eating a certain way and he likes to do this a certain way?
No, he's actually pretty good about listening on my, he calls it a little crazy sometimes. It might be a little excessive, but I try to be as healthy as possible because you're right.
So her husband is narrow-minded, like every other husband, I get it. And she has to fight with him to do everything that she needs to have done. Okay? So you make sure your husband listens to this, and if he wants to give me a call, I'll tell him that he better open up his heart and open up his mind because he's a danger to his family.
Okay.
Okay? And men think they know everything. They're the boss of the house. Well, no, they're not. A man's job starts when he gets home. And that job is to protect and respect and honor his family and to make sure that poisons don't come into the house. And he's going to make sure that everything is done naturally. See, men were programmed to believe that once they pay the mortgage every month, their job's over. Okay. And that's the truth. So he's stubborn, and I get it, but he better not be. And you know what? I'm going to tell you, you let your husband hear this, and if he was smart, he'd listen to everything that you want to do when it comes to health in the home, food, okay, and everything else. If he doesn't want to do that, then guess what? Then you'll be rushing these kids to emergency because you guys don't know what to do with them. They get a fever, you run them in. What do they get when they get a fever? Well, they're going to get antibiotics, all right? And then we know that antibiotics are like an atomic bomb for a child, and their immune system hasn't even come in yet. All right, I think I said enough about that. Let's keep going. Amanda?
Yes.
Your low back, what do you feel?
I would say when I got pregnant, you know, I got a lot of lower back pain, obviously, from gaining all the weight, things stretching and softening and moving and, you know, getting ready to prepare to give birth and all
Okay,
that.
one second. I'm going to have to stop you just for a second.
Yeah.
That's not natural. A woman, okay, she will expand naturally if she doesn't have scar tissue. If she has scar tissue, is scar tissue elastic? Will it stretch easy? No. It will micro tear, just trying to get her to open up like she should, like her pelvis should. It will micro tear. And that pain that she's feeling is from the scar tissue in her, not because nature made a mistake. Let's make that perfectly clear. We do not have doctors that have intelligence about this. The reality is that when a woman gets pregnant, she creates a hormone that actually, you know what, when you do belly button therapy, Amanda,
Yeah.
do belly button therapy and you'll open up more. When you do belly button therapy, that will actually dump more dopamine, oxytocin, serotonin, and endorphins than anything else you can do, which will open you up and relax you. I'm telling you, it's very important.
Yeah.
And you can do that all the way through your pregnancy. You're not going to poke the baby in the eye, okay? Okay? All right. And just do it to the comfort zone, right? And guess what? And every time you do that, you're dumping dopamine, oxytocin, serotonin, and endorphins, and not adrenaline because you're worried about the cesarean or will this baby be healthy. And I just love it. You know, what do they get us to do? Something so silly is to count the fingers and the toes. Are you doing iodine, Amanda?
I actually just read on the bottle that I have from you that I can do it. It was like 7 sprays.
If I was pregnant, which I probably can get pregnant, at least that's what I've been told. Okay, all right. Okay, actually the other day when I went to Shalou's house, she fed me a lot of cooked food and it wasn't combined well. I told Lori I did feel pregnant, but then I realized in the morning I wasn't. I gave birth to something else. Okay, all right. So.
That was good.
Okay, so where were we? Okay, I got all excited.
Oh, my lower back pain.
Okay. Just understand something. We're going to keep on coming back to your core. If your core is not strong, then your back has to be tight. Because believe it or not, did you know when you pick your kids up, you have to use your core, not your back. But if your core is weak, now there's not a woman alive that had a cesarean that has a strong core. It's gone, baby. So, you know, you got to go in and get rid of that scar tissue. And I'm telling you, if you got a Wolf non-surgical done on that scar and on that abdomen, even right now, you're not going to lose the baby. Oh my God, don't touch it, she's going to lose. No, go in there and just gently start working and loosening up the knots. Okay, where's my roll? Can I have that? So I want to show you something, Amanda, and then you'll understand this, love. Okay, just know this. Your digestion was better, your assimilation was better, and your elimination was better before you had the cesarean. Yes or no? Yeah.
Absolutely.
Okay, you're screwed. You are, and it's not your fault. And your husband better know something. When you're complaining about your low back, she's got a low back problem. When she's complaining about her jaw or anywhere else, because you're continually being.
All sweaty wet.
Sarah, this is my husband.
Slide by. How you doing?
I'm doing. How are you?
Good.
Good. Take the chance to listen to the whole video because I waited until you were out of the room because you're pretty big and I've been picking on you. Okay? All right?
Don't worry. I'll take a look.
But just know I run faster than you. Okay? So that's going to be really important. After you watch this video, just know you can't catch me. Okay, all right.
I'm not gonna.
Okay. Okay. So anyways, just know this. You have no idea. If I could show you your abdomen right now, you would see it looks like a landmine. Yeah. Yeah. It's.
I can feel it.
Yeah, I know. I know you can. So does every woman. But guess what? Just shut up and suck it up. Shut up and suck it up. It's in your head.
Right, of course.
Okay.
Yeah, it's all in your head, right?
Yeah, that's right. Okay. All right. And then your husband was taught too. Shut up and suck it up. It's all in your head.
Right.
Yeah, okay. Yeah, yeah. So we're all taught that. All men are taught that. So it's not his fault. But you got to hold the loving line and just say, I'm doing this, this, and this.
Bye, Baba.
All right. So here's the reality. So now that you're pregnant again, if you don't learn how to food combine, and if you don't introduce a lot, and if
Sorry. Hey. I'm sorry, Daryl. Give me 1 second.
first of all, don't be sorry, okay? All right? It's all good.
Yes.
All right? We'll wait for you, okay?
Sorry, 1 second.
No, you're not. Don't be. Just take your time. Go get him. Beat him on the head. Men aren't there today. There are some men that are there, but most aren't there, okay? Because that's part of them being macho, is not listening to the feminine. They're programmed. All right. How are we doing?
Very good.
Okay, 2 down, 1 to go. All right. All right, so anyways, where was I?
Lower back being shot, abdomen being shot. Everything.
Well, okay, I don't want you to think that you're a lost cause, because you're not.
Definitely not. I don't feel it. I feel like...
No, but I got to it's a cumulative. You're 32.
Yeah.
When you're 40, it's coming for you, baby. So,
Right, if I
guess
don't
what?
work on it.
You want to get rid of all the scar tissue. You can't work on it. When I say this, I mean this in the best way. Do you give me any money, Kimberly?
No.
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 Understand something. You go and do exactly what I said. You make sure that Kimberly goes in there, and it's called your SI joints. Remember, when you walk, okay, this is what they do. And I guarantee you they're froze. And you're starting to waddle like a little duck. Okay? No, but you, yeah, go ask your husband. Say, hey, you've been looking at my butt for a long time. Does it wiggle the same? Okay. All right. Well, the wiggle comes from here, and it's a natural wiggle. And when these get full of scar tissue, they don't, and they're going to have it, okay? Because you can't have a cesarean. And if you look at where they cut, the main cutting points are right in front of the SI joints. And you know how people say I've got sciatic pain down my leg? Well, that's these two things, okay? They get scar tissue and calcified. So if you let Kimberly go in there and loosen these will loosen up. They're like the magic points. And then if you let her go in and do your sacrum and your coccyx, all the way down to the tip of your coccyx, and then up as far as L5. So the tip of your coccyx all the way to L5. Why do I want her to go all the way down to your coccyx and go in there and loosen up everything? The Holy Grail is your vaginal canal, your ovaries, your uterus, everything. Okay? We want to go in and make sure that, guess what? The coccyx, if she goes in and does that, that means that the doggy can wag her tail. Because the coccyx needs to move and have freedom. And believe it or not, you have what's called the pelvic girdle. You know that, right? Everybody has what's called the pelvic girdle, your pelvis. It's open. It houses your core, the lower part of your core. And what's happening is, do you ever hear about women losing their babies all the time? Because the core floor is rotted out from them pooping in their pelvis. Well, how do you think the tissue rots out? Because they turned into a swamp. Now your pelvic bowl will fill up with infection. That creates inflammation, creates scar tissue formation, causes bladder infection, causes ovarian cysts, causes endometriosis, causes fibroids, and then active fibroids. We could call those tumors, and those are just stage 4 inflammation. Everything is based on inflammation. And then guess what? That'll happen around 40. Then you get what? Dryness, vaginitis, Okay, you get thinning of the uterus or thickening of the uterus, depends what goes on. And then guess what? And then by the time you're 60 or 70, you get hip replacement because the infection in the pelvic bowl, it came over the sides and went into the hips. And what happens is infection creates inflammation. That stands for inflame. It dehydrates the tissues. And you've got dehydrated tissue right now. They're adhesions from the surgery. Remember, surgery causes more scar tissue instantaneously. Instantaneously. You know what? A woman that never had a cesarean and she's 85 years old doesn't have as much scar tissue as she has in her abdomen at 32. So where is she going to be when she's 65? All right? Are you with me? You might have to go. You might have to go back and listen to this. Is there any way that we can keep focused? Is there? He will handle the children. He can do that.
I'm gonna hope so.
I don't think so.
I don't think so either.
I'm gonna put $20 on the table that he does not. And when I come to Bonita, Florida, I will give him the $20. But I guarantee you, there's another interruption going. You go do your best. No, you can go in. You can go and tell him that it's the $20 is on the table.
On the table, babe. Okay, we're back.
Are we? I don't believe you.
Yes, I hope so. I'm with you.
Okay. All right. Did you get what I said then? Repeat what I said.
did.
Okay.
About being 65 and not doing so well because of all the scar tissue and inflammation and dryness and thickening. And
Well, I was telling you that what I said, but I also said when you're a little busy, that a woman in her early 80s has less scar tissue in her abdomen than you do.
no cesarean.
No cesarean. That's right. But I know, but I'm trying to tell you, it's not good.
Yeah, mentally, yeah.
So just know it's accumulative. Remember the dam? Well, if things are floating down the river, are they going to get caught up behind the dam?
Of course.
What are we going to call that?
A blockage.
I call it a damn mess.
It is a damn mess.
Yeah. Okay, all right. Okay, so understand that the more that happens. Now take a look. Did they cut you from side to side or up down?
Okay.
Huh?
Side to side. Side to side.
Side to side. Okay.
Yeah.
So understand something. You are going to have low back problems. You're going to have kidney problems. You're going to have hip problems too.
Yeah.
Why? Well, they cut you side to side. So
Right.
if they cut you side to side, then that means if they cut you side to side from here to here, right? Okay, look where your hips are, right here. And I told you, you can get 3-inch feeders, and that's going to go into your groin and your pelvis, and it's going to cut off the circulation. So now, think about this. So with all that scar tissue, we know that we're backing up things. Oh, it's going to be unbelievable. Right now, you got it handled. But just remember, I warned you. In 10 years from now, you're going to have a pot belly. It doesn't matter how many yoga stretches you do, and it doesn't matter how many sit-ups you do, and it doesn't matter even if you're on the best Live It program eating, okay, nourishing, it's not going to go away because you've got a scar tissue issue. Did you ever eat beef jerky, Amanda?
Yeah.
Well, that's what you are. You're a piece of beef jerky in your abdomen right now. And that's going to get, and what happens is you have the same amount of fiber, but the inflammation stands for inflame. And when they cut you open, they terrorized all those cells because that's trauma, right?
Yeah.
You could have been put out and asleep, but they're still traumatizing because if you don't think that there's intelligence in every cell, then then your science class was really weak. Okay?
Yeah.
So now when they did that, you got all of this scar tissue in here, and now that scar tissue goes this deep. The feeders go this long. They're adhesions. They're bands. Go look them up on Google. And that's what you're going to be dealing with. So we want to get rid of those because it's not just going to be the front where you'll have trouble picking up your children because you'll be weak there. You'll be using your back. So that means since the cesarean, you were using your back to pick up your groceries, to get yourself off the toilet, to get yourself in the car, to hug your children. And understand, then that causes all this stress in L3, L4, L5. Now, then they're going to tell you that the discs are thinning out, and they're not. They are getting infected and inflamed, and they're not thinning out. Remember the beef jerky? Well, you can take 1 inch thick of meat, and they will dehydrate it, make it into beef jerky, and it's less than 1/4 inch. Are you with me?
I'm with you. Yeah.
Okay, got it.
Trying to understand it all. Yeah.
Okay, all right. So that's what we're, so let her go in from L5 at least. I would let her do your whole spine if you can afford it, if you got the time, if you think you're worth it. But most women aren't worth it, okay? Well, you're not, okay? And then the husband's going to tell you you're not either, okay? Well, most do. I'm not trying to put them down.
I get it.
Okay, I'm going to keep on elaborating because what's your husband's name?
Clay.
I can't wait until he watches this video, okay? Because understand something, if he's awake, he'll go, oh my God, I do say this. I do treat you like that. I didn't know it, honey. I bow down to you. I bow down to you, okay? You are the queen of the house.
That would be nice.
Yeah, good luck with that. Okay, so anyways,
I'll need it.
I kid you not. Okay, yeah, don't worry.
I know.
I know. I'm still thinking I'm going to keep that $20. Okay, so so the reality is, did you have a consult yet with Kimberly?
Consult about like the C-section area?
No, about how to do a perfect day diet from the moment you rise till you close your eyes.
I don't think so, no.
Did she bring it up?
Maybe.
Don't lie for her. Don't lie for her. Okay, just know that if she didn't, that we will never work with her again, though.
Gonna put me on the spot?
I'm just kidding. Okay, so what you want to do is you guys get together and do a perfect day consult, okay?
Okay.
I'm telling you, it'll rock your world. And at least when you know that when you do something, you're going to go, oh my God, Kimberly was right.
Okay.
Right? Wouldn't that be great? You don't have to believe her. You don't have to trust her. But understand, when she gets done and she does that consult for you, you'll have the audio, okay? And then she'll give you my perfect day guide, which is a 400-page manual. And you've never seen anything like this. You'll be able to go in there. You'll see what emotion is attached to what. You'll see so many things that you can do with the kids. You can use that manual and call Kimberly, or you can call me, okay? All right? But don't give your husband my phone number.
Okay, promise.
Okay, all right. Okay, fine. Okay. So what's going on with your jaw?
Okay, so I broke my mandible, completely severed it when I was 5, in like a bike accident. And they sewed it shut for, I don't know, a month or so, with the metal wiring, so my mouth was clamped. And I think back then, early 90s, they were just hoping that it would just grow back together properly, and boy, it did not. So it's, all out of whack. So I felt always, clenching, grinding, the bite is not right on all levels.
Okay.
Set back, all of that stuff.
Don't worry about it. Don't
pain throughout my body because of that.
don't let anybody touch you. Don't let anybody touch you, because I'm going to tell you something.
Yeah.
Let Kimberly work on you, and I'll guide Kimberly. And I'm going to be there in October, and I promise you that whatever she can't get at, you come in and it's done. We're not talking about trauma to you. I know how to get in there and understand. Kimberly, do I know how to get in there?
Oh, yeah. Yes.
And I'll turn it around. Can I tell you that? Do you know how many times people come to me and they go, well, I have this bite plate. I'm going to get a new one. It's going to cost me $20,000. Please don't get it. And I'll tell them not to. They'll get it. And then guess what? They come to me, and it usually takes one treatment.
Yeah. I believe it. She did a treatment and like a light little baby touch-up.
She can't do that. What you got to do is you've got to allow her to go in and understand something. Kimberly will usually not work deep enough because she's like, oh. Yeah, me, it's, okay. So what?
Her.
What?
I really, really deep because she let me. She stayed in breath, and she let me, because she was like, I want this more than anything.
You're gonna have to go deeper.
Well, she don't want me to do that. But she's gotten so much relief. She doesn't have pain anymore. She doesn't wake up with her fingers clenched and her toes clenched.
Well, just make sure that you're doing both sides. Both sides. Okay,
Yeah.
you need to understand, when a woman has problems in one breast, it's already starting in the other. When you have a problem with this side of your jaw, it's already over here starting. If you don't believe me, guess what, Kimberly? You go in and work on this jaw till it's completely feeling like it's amazing and it's been healed. You've gotten rid of all the scar tissue, and you should be on at least Merigen and Dentogen once a day of each. Okay, I would do Merigen at least once a day and Dentogen twice a day, and then we will get all of the calcification back into the jaw, and then what I would do is you do her jaw, just this one, and you know what you're going to tell her? I don't know what you did, Kimberly, but you made this one feel great, but this one's messed up now. No, you know, you've got children, right? Which child is the screamer, the loud one?
Like both.
Really? There's usually one.
There's usually, okay, maybe.
Okay, so let's eliminate her. Not eliminate her, but now the other one's the loudest, you see? So
absolutely.
whoever's the loudest sticks out and the other doesn't. That's it. And that's why people go, you know what, you fixed my neck, but now my knee hurts. No, but hold on a second here. I never touched your knee. It's just that it didn't scream as loud. Let me tell you something right now. So you're 32, and at the age of 32, even if you looked after yourself, if you wanted to totally get rid of the scar tissue in your joints, your muscles, and in the organs, especially your abdomen, you'd be looking at 12 to 15 hours. That's your whole body. Okay, because if you're like 40 years old, you're looking at 30 hours because it accumulates. Remember what I told you? Okay, if you've got a chronic problem, where let's put it this way: we have a money-back guarantee that the first treatment, people will cancel their surgery. Okay? Yes.
And I know it very well.
Huh?
I know it very well. My mother-in-law and her best friend did it.
Yeah. So people, like, you gotta understand, chiropractors, acupuncturists, and I have a doctorate in acupuncture, and massage therapists. I also was a registered massage therapist a long time ago when I was really young. And they don't know about this. They don't understand this. They don't know how to deal with scar tissue. They don't know how to deal with calcification, and that's why we own the holy grail of the physical work on this planet. And understand, you can trust in Kimberly. But Kimberly, just keep going, keep working on that. Are you clapping your jaw?
Yeah. A little bit, yeah. I should be doing it a whole lot more.
So if you could clap it for about 10 minutes each side, 10, 15 minutes each side, okay? 5 minutes on this side, the good side, 10 to 15 on this side, and you start clapping it like easier. Where's clapper? Do we have one? Someone? Thank you. So there's the clapper, you know, and I clap my neck, my face, my head, and I do it an hour and 10 to 15 minutes every second day. Okay? That's why I'm so beautiful. Didn't you notice that? I'm kidding. Okay, but I do that to get rid of the stress, right? Get rid of the tension, get rid of this. Well, you'll get rid of it all. You got to go serious about this.
Yeah, I know.
Well, I know, but you're going to be beside your husband, and you're there, and you're sitting there, and you're clapping, and he's going, do you really have to do that?
No, I'm not shy. Trust me. We're good.
Okay, I just wanted to make sure. I'm checking in on you just to make sure. Okay, all right. Okay.
He's a good fan. We're good.
I don't know. I really want to trust him, but yeah, I'm on the fence
We'll see
right
about the $20. We'll see.
Okay. So what are your questions?
Okay, so then I just do the Cesarian, the work on it with the belly button tool.
No, the belly button tool is for the belly button. And that's to release lots of dopamine, oxytocin, serotonin, and endorphins. You do the belly button therapy 3 times a day and unleash, because when you do that, it'll put you into a present moment state. Like, do you know how you get anxiety sometimes?
I I have children, yeah, of course.
Okay, when you get anxiety, you need to do no, but you can't do that. You know, this baby picks up everything.
Yeah.
Okay, you know, don't scare it for not coming out. I'm going to just tell you something, and you may not want to hear this, but I need to tell you as a mother, and there's a lot of mothers probably listening right now. When the baby has its feet on both sides of the vaginal canal, it's because it doesn't want to come out. It's scared. It's not because it's stupid. And you know, women don't even think about that. Men don't think about that. Doctors don't think about that. When the baby has the umbilical cord around its neck, do you know what that means? It's trying to hang itself. Okay, well, do you think that some of the relationships that we know with husband and wife, or where the wife is left alone and she's terrified, what do you think the child wants to come out? We're talking about a high vibrational spirit in your womb.
Yes, yeah, it makes sense.
But for a lot of times, it feels like it's in a tomb.
Yeah.
Okay, all right. And remember something, that is the highest that spirit will be, because as soon as that little spirit comes out as a physical body, okay, it will be dumbed down every day due to the food it eats, what it drinks, and what it has to listen to. All right. I just want people to understand that. That's why we put this pain-free pregnancy course together, and we have a course that a couple can come to us, or a single person. We do everybody. They can come to us a year prior, or they can come us after they're pregnant, or even if they think they're going to have more children, and we show them how to have a pain-free pregnancy a year before, what the father needs to eat, what the mother needs to eat, if they really want to bring their vibration up, and if you want loving in the oven, okay? And how the father needs to treat his wife. Because men don't know how to treat a pregnant woman, but I know yours does. Okay, now, so here's the deal. So we need to be trained. Even if you get a Perfect Day consultation from her, you're going to understand a lot of things about your kids.
Okay.
All right? And they're all, your kids are different. They all have different personalities, right?
I know it.
And that's because you and your husband acted different at every pregnancy.
Yeah. Absolutely.
And while the baby was in the oven, okay, there was different ingredients going in called frequencies that created a different personality coming out.
Yeah.
Okay.
Yeah.
You get all that?
Nailed it. Absolutely.
Yeah. Okay. So now what we need to do is support our children and helping them to get rid of the beliefs that are dysfunctional.
Okay.
And guess where they got them from? So you're not going to punish your child ever again, are you? You're going to sit your child down like a high vibrating spirit being, and you're going to say, yeah, why did you try to stab daddy in his sleep? And then they're going to tell you.
Okay.
Okay?
Explain it. Yeah, understand it.
Yeah, I exaggerate everything, okay?
Yeah.
Okay?
Okay.
All right?
I like it.
Because we have all these people here, you know, feeling neglected.
Hey.
Say hello, everyone. So she should be lucky that she's not here, right?
Hey, so PKU, can you speak to that condition and what she needs to do for that? One of her daughters has that, and
Why don't you explain to everybody what it is, Kimberly?
so I think what it is it's
Well,
protein.
Okay.
You can't have protein because it gets stored in her brain. That's what my understanding is.
So what's
That's
what's her blood type?
I honestly don't know her blood type.
Okay, can you believe this? Can you believe this? So the medical system says she has some kind of genetic condition that she can't digest protein, and they don't even know what the blood type is. So just know this, find out if she has blood type A, and we can talk about it later. But just know this, I don't believe that condition exists. I do believe that maybe she might have gotten some MSG, or she got, what's that called again, that chemical, Lori? Diacetyl. Okay, there's about 5 different chemicals, and you've got them in your kitchen. and understand they cause leaky brain. And the other
I
thing is,
feel-
yeah, well, just go on Google and go 6 worst chemicals, okay, in our food. Aspartame is another one, okay? Fluoride is another one. She might have been fluoride poisoned. You know, who knows? The reality is that everything is reversible. And I'm allowed to say this. I'm not your doctor. I'm not pretending to be a medical doctor. And I don't believe in PKU. And I've dealt with this many times before. And is she eating animal protein a lot?
The baby can't. She's never had it, will never be able to because of this metabolic disorder.
Okay. Well, let me put it to you this way. It can be changed. So what is she on? What does the baby drink? What does she eat? Tell me.
So we have a geneticist and nutritionist for the rest of her life.
Okay.
And basically it's like a medical formula that supplements everything that she's lacking in the normal daily diet. So she can only have 6 grams specifically of protein a day.
Why give her any protein? Why not just give her amino acids? Why not give her amino acids?
Well, I mean, there's 6 key amino acids.
No. That's not what I'm saying. They are giving her protein in this. What is it made out of? Soya? Animal?
In her formula, you're saying?
Yeah.
I'm not thrilled about it, but yeah, I'm sure.
I'm not thrilled about it.
Corn, all that crap.
What?
I'm sure there's soy, corn.
And it's GMO soy and GMO corn. Do you hear yourself? I think I should probably quit this right now because I don't even want to say things. I don't even want to go down this road. If you ever want to call me, you can. But I will never play with your child's life. But the reality, if that was my child, we would never have to go down this road. Okay? Never. Okay, so do you know that soy is a concentrated protein, right? Hard to digest, right?
I absolutely do.
So why aren't we giving your child amino acids, which come in plant foods? Okay, why aren't we giving it, if you want to do something, check SON formula. That is 99.9% absorbed without any energy into the cells. Why aren't you doing that? They're never going to go.
About it.
Yeah, and why don't you go and take that formula and go analyze it and find all the chemicals that are in it.
Yeah.
Why don't you go do that? And then watch the side effects that she's going to have. Let me tell you something. Did you hear what she just said? She has a what? A chemist and a nutritionist for life. Doesn't she sound special? Guess what? She's going to have special needs. So neither of these two people, this nutritionist, has not studied real health, nature's health. Okay? The chemistry. Watch the chemicals that they sneak into this little girl. Watch the drugs that they put her on because of the side effects from this amazing formula. Oh, and the parents need to feel real special because she's got a nutritionist and a chemist for life. This is where, no.
Yeah.
Let's just say this, Amanda. You watch what happens down the road with this little girl. And all the allergies, the asthma, the digestive disorders, all in the name of what? Science, not nature.
It's my fear.
Well,
Every day.
you don't have to have any fear. You just have to do your research. Don't trust me, but don't trust them.
Yeah.
And trust a mother's instinct.
Always.
There is nothing higher than a mother's instinct. Don't trust Dr. Wolf. Trust a mother's instinct. And if your spider senses are telling you this already,
They have been.
now here's how a man thinks. Problem, solution. We got it, honey. Boom, solution. I'm back to work. Mommy? Whoa. Honey, I don't know about this. Oh, come on. These guys are specialists. They're professionals. You do know that almost all pharmaceuticals are made out of petroleum. You do?
I do now.
Okie dokie, pokey. All right. Well, it's been nice talking to you, Amanda.
Thank you. I appreciate it.
Yeah, you better find your BraveHeart mama roar.
I'm going to try my hardest. Kimberly's been working on it a lot with me.
Don't say try. Say I'm going to do it.
I'm going to do it.
I'm going to do it.
I'm going to do it again.
The last thing we need is for women trying today when men are destroying the world. Thank you very much. Are you done trying? Well, I'm in the process. I'm in the process. What the heck is that? Amanda, do it. Amanda, do it. Wait till you get my bill. Now you really pissed me off. Thanks, love. You're amazing.
Thank you.
Have a beautiful day. Thank you, Kimberly.
Thank you, too.
All right.
Thank you. Thank you.
You're
Bye,
welcome.
y'all.
Bye.
Okay. No, not yet. Everybody, thanks for joining us, and we're going to get back to teaching, right? Okay? And just know this. I will never, ever tell anybody what to do I? I never do. I never will. But guess what? Wouldn't it be great to have options instead of it's my way or the highway? Doesn't that make you think my way or the highway? All I want to do is give people options, okay? And if that makes me evil, if that makes me some kind of culprit, well, let it be. Because guess what? Do you think that a child should have the best chance at having an amazing life? Understand something. Everybody, you know what? I'm going to tell you something. All of you that are out there silent and you've got your mouth shut, shame on you. Shame on you. I'm going to go now, but listen, I'll be roaring for everybody else that's being silent. And that's why I have to speak so loud. Just think if everybody would just meow once in a while. You think about that.